Hello, Dr. Ebert. For my video project, I have skills list A. So my first 5 skills will be cervical active range of motion, rotation with the goniometer, Sperling's test, muscle length testing of the SCM, accessory motion testing, thoracic unilateral PAs on one side only, and joint mobilization performed prone, doing central PAs C2 to C7, grades 1 through 4 to any 2 segments. Okay, so to begin, we have cervical active range of motion. So Katie, what I would like you to do is take a seat in this chair. Okay, so the motion I first want you to do is look over your right shoulder. So, okay. And now over your left. All right, so now I'm going to take a measurement of this. So I am lining the goniometer up. The axis is in the middle of her head. The stationary arm is in line with her nose. And go ahead and look over your right shoulder for me, Katie. Okay, I got 70 degrees. The moving arm is in line with her, the crest of her nose. And now go to the left. Okay, and got 80 degrees on this side. So Katie has more rotation to the left.
Interesting.
So now, next up is Sperling's test, so I'm in a good position for that. Katie's feet are on the ground. Uncross your legs, please. So this is looking at radicular symptoms. And so first thing I'm just going to do is tell Katie to, just want you to relax. I'm just going to apply a downward force onto your head. Let me know if it reproduces any of these symptoms you've been having.
Okay.
Any reproduction of your symptoms?
Nope.
Okay, so now what I want you to do is just bend your head back a little bit, like so bring your eyes to look at the ceiling just a little bit. Okay, same thing. Let me know if you have any reproduction of your symptoms. Anything?
Nope.
Okay, so say Katie's involved side was the left side. I want you to bring your right ear towards your right shoulder just a little bit. Like right here is perfect. Yeah, maybe a little bit more. So same thing. Let me know if you have any reproduction of your symptoms. Anything?
Nothing.
Nothing. So now we will go to her involved side, which is her left side. So she can bring her head about right here. Hold that position.
Break the chair.
Any reproduction of your symptoms?
Nope.
Okay, so this test would be positive if Katie reported symptoms with any of those compressions, and then if she did have symptoms with any of that, I would go ahead and do a distraction test, and I would also ask her where she had her symptoms and what side they were on. So
specific.
The next thing we have is muscle length testing of the SCM. So Katie, can I get you to lay down on your back for me, please, with your head facing that way? Okay, and I want you to scoot back for me. Doing gymnastics. Okay. So I just want you to relax. And ideally, I would like to be seated doing this. Our options are pretty limited here, so I'm going to be standing, trying to have good body posture. Okay, so to Test the length of the SCM. I'm stabilizing at the clavicle and the sternum. And if I'm testing her right side, I'm going to bring Katie into left side bending with right rotation. And then I'm not noticing any symptoms. I bring her to a little extension and I'm feeling some muscle tightness. So I would say she's positive for SCM muscle tightness. So you can go ahead and relax and scoot up. I don't want to let go of your head. God, I forgot what's next already. Okay, so now accessory motion testing, thoracic unilateral PAs. So Katie, can I get you to flip over onto your tummy for me? Now I'm just assessing the motion you have at your thoracic spine at each individual vertebra. So could I get you to scoot towards me, please? What?
My towel smells good.
That's good. Warm up my hands for you.
You already put them on me.
Yep. Well, that's when I realized it. So unilateral PA, I'm going to find a thoracic vertebra, and then you come over one thumb's width, and I'm feeling now for the articular pillar.
Yeah.
Feeling for the valleys and ridges. Okay. So now just applying a anteriorly directed force to assess the mobility. All right, and lastly, I have joint mobilizations, central PAs, C2 to C7, grades 1 to 4 on A2 segments. So this really isn't ideal because there's not a face hole in this table. I'd like Katie just to be able to go face down. Luckily, I have a good patient who's willing to scoot to the edge of the table and hold her head. So I'm coming off her occiput, finding C2, that's the first spinous process you feel. Katie's doing a really good job supporting her head. So go ahead and do a central PA. Careful not to wrap my fingers around her neck. Once again, just assessing the mobility and the integrity of the motion that she has at this vertebra. While I'm here, I'm going to go ahead and do my grades 1 through 4. So, grade 1, just enough to bend a fly's knees. Grade 2. Now coming in, doing a grade 3. And a grade 4. Okay. Coming down now to C3. Assessing the motion there. She actually feels a little hypermobile. I know, right? C4. Okay, Katie's really stiff here, so I'm going to go ahead and do some mobilizations. So first, grade 1. And grade 2.
You're not getting anything. There's no motion there. That's crazy.
Yeah, she's very stiff. A grade 3. Plus.
Her fingers.
And grade 4. Okay. Coming down now to C5. She does have some more mobility here, which makes sense to have a hypermobile segment below a hypomobile segment. Okay, C6. And C7. Okay, and that was it for this round.